Hi everyone, and really welcome to this session. I am Dr Maria Kett, and I'm Associate Professor of Humanitarianism and Disability in the UCL Institute of Epidemiology and Public Health. I'm joined by my colleague Dr Ben Oldfrey, who is from the UCL Global Disability and Innovation Hub and the UCL Institute of Macon. You'll hear more from both Ben and I shortly, but we're really excited here to introduce to you today a new MSc programme we're starting at UCL, which is called the MSc in Humanitarian Policy and Practice. And I think Alison is going to share a screen, and Ben and I are going to do a short presentation, shortish, to tell you a little bit about the programme. Please do, if you want to ask questions, perhaps either post them in the chat, or we'll have plenty of time at the end. Ben and I are going to speak for about 15-20 minutes. And then there'll be time for you to ask questions, lots of time to ask questions at the end, comments, whatever. So please do either post them in the chat or save them. We're hoping we'll be joined by a few more people as we go on, so we might hear a few pings. But yeah, without further ado, let me get started. So next slide, please, Alison. So this programme really is for anyone who's interested to know more about humanitarian issues. I guess we see this in the news, we see what's happening in the war in Ukraine, the famine in the Horn of Africa, but there are also lots of unreported or underreported humanitarian scenarios around the world. And I guess one of the things we might think is, why do these situations end up being so protracted and for lasting for so long? And this course is really designed to get people thinking about the real fundamental issues in humanitarian context and to start really probing. So if you're interested in a career in that field, it's to really set you up with a set of skills to really probe around those issues. Next slide, please. Before I move on to tell you a little bit about the course, I guess I'll tell you a little bit about me. Sorry for the busy slides, it's mainly to remind myself. I have been working in this field for quite a long time. I'm an anthropologist by background, and I did most of my primary work in my fieldwork in China. And from China, I then did my earliest work looking at forced migration and long-term refugee settlements and contexts in Azerbaijan and Bosnia. And that led me to working in post-conflict societies. And from that, I ended up doing work around conflict and disability. So I have quite a strong background linking those two sectors together, the humanitarian world and the disability world. I have been a member of several sort of global groups looking at how better to ensure people with disabilities are included in humanitarian action, including the Sphere Handbook, working with the International Red Cross Red Crescent to develop guidelines. I've also spent a lot of time in different countries, particularly in West Africa, in Sierra Leone and Liberia. And the picture at the bottom of the slide is working in a settlement in Sierra Leone, and the top left-hand picture is me undertaking fieldwork in Liberia. I've been going back and forth to Liberia for many years and had the fortune or misfortune to be there during the Ebola crisis, and really looking at the impact of the Ebola crisis, for example, on people with disabilities. I've also, perhaps linked to the humanitarian work, been doing a lot of work around climate change and climate action. And that started some time ago now with colleagues in the middle picture, from colleagues in Kenya and Bangladesh, where we actually went to COP in 2017 to present our findings. And that work is still ongoing, looking at climate and disability. I've also, and this is the Ben and I connection, have been doing a lot of work around assistive technology in humanitarian context. I'm not a technology expert, but I'm certainly an expert in the humanitarian context. More recently, and perhaps as a result of COVID, I've been doing work in my own local community, which is a really different and interesting context. So really looking at health inequalities in a very diverse community in Brent, where I live. So I've got a lot of different, both practical perspectives. I have a healthcare background, as well as academics through the anthropology, and really trying to bring those applied approaches to my research and to my teaching. So I can talk more about that after, but that's just to give you a brief overview. And I'll bring all of those to the course. Yep, next slide, please, Alison. So really this course, as I say, I've got a lot of background and interest in colleagues working in the humanitarian sector. And we know that there's a real need to provide people working in the humanitarian sector that have these really inquiring mindsets and skill sets, and really want to know a bit more about what's behind the story that we see in the news, and really have the skills to help analyse, unpick, and think about those situations differently. And really, fundamentally, the point of it is to really make a difference to lives of people affected by crises. That's front and centre to what the aim of the course is, that it's not just a course to to give an academic set of skills, but really to help people to make a difference to other people's lives. So we really want this to be a balance between practical skill sets as well as theoretical backgrounds and frameworks, and understanding what the evidence says, what the research is showing. And for that, we'll have really bring the sort of real life context to this. And I think Ben will give a good example of how he's going to do that in his course. Obviously, I've talked a little bit, a bit about the healthcare setting. I have a background in healthcare. We're in the Department of Epidemiology and Public Health, but certainly we plan that while there is a lot of research around healthcare and an evidence base that we can use, that it's not just around healthcare. And perhaps one of the joys of coming to somewhere like UCL is you really can access a range of other academic subjects, faculties, experts from other faculties, including security, human rights, international law. And that's really important. You get a breadth of subject space that perhaps you don't get at other universities if you're looking at one particular subject speciality. And we really want to bring those together in sort of methodological, ethical, and other applied skill sets and competencies. So that's a really important facet of the course. A little bit about the course. Next slide, please, Alison. We've got a range of modules to be covered. Of course, really core to this is understanding what humanitarian policy and practice is in the current situation, in the current times. And there's been a lot of work to try and really develop and improve humanitarian action. Some of you might know that in 2016 was the first World Humanitarian Summit, and that really was where what was called a grand bargain to try and think differently about humanitarian action and try and shift the balance of power. That's also led to a big push to what's called a localization agenda, to try and take the power out of rich countries to provide more power and resources to countries that are directly affected by humanitarian emergencies, so people affected can make decisions and choices themselves. But it's not always that straightforward. What research methods do we need to do? How do we know what we're doing is working effectively and having the impact and having the benefit that we want it to have? So we really want to give you a set of skills around how to ask those questions, analyze the data, unpick the stories by using different research methods. We also want to look at how we know when outcomes, when interventions that we're doing have really led to an improvement in people's lives, whether that's health improvements, education improvements, or improvements in security, etc. So we really want to look at what the evidence shows and how do we test that evidence to look at whether we are actually making a difference. This has been a really key question in the humanitarian sector. You know, huge amounts of money, huge amounts of people, volumes and volumes of work done, reports written, but what difference is it making to people's lives? And if it really is making a difference, why do we still see the same things happening time and time again? Some practical skills. We want you to learn about how to do projects, programs. How do you develop a program from its inception right through to the budget, the planning, to the application of those ideas on the ground to really deliver? How do you write grants? How do you write budgets? How do you know what you're doing is sticking to time and targets and goals, all those practical skills? But we also want you to think about this, as I said, in the wider context. And one of the key messages, given my background and Ben's, I've worked on disability, that's an obvious intersectional issue. But we also know other groups, age, LGBTQI, that's been a really under-researched area in humanitarian, you know, and whole issues of power dynamics between different groups and how that plays out. So we really see the intersectionality. You know, we know now that for many things, one size doesn't fit all. So how do we really deliver more effective humanitarian action for different groups? And finally, and most excitingly, perhaps because we've got Ben here, Humanitarian Technologies. And I'm going to hand over to Ben to tell us a little bit about what that module will contain in more detail. Thank you, Ben.
Cheers. Thanks, Maria. So next slide, please. So just before I explain a little bit about the Humanitarian Technologies module, just to let you know a little bit about me. So yes, I'm a research fellow at the Global Disability Innovation Hub, and I cross over with the Institute of Making, which if you're at UCL, you might know is a central making facility, materials library. And the sort of mixture between those two things is I'm particularly interested in the making of assistive technology. So assistive technology is, it can be many things, but the particular area I work on mostly is around mobility. So under the 80-20-30 programme, which is a large UK aid programme that GDI have lead on, I work on a number of different research streams. I have this focus on mobility, as I said, so prosthetics comes into this, 3D printing of prosthetics, where digital fabrication can help. Maria mentioned the word localization, localize activities, bringing the products where they need to be. And a critical point around that it's important for most assistive technologies that make them a little bit harder to supply than other technologies is the fact that very often, in order for them to be effective, they need to be customized. They need to be made bespoke to the user, or they just don't work. I mean, I've got in the sort of top left there, I've got a picture of a prosthetic socket that the residual limb of a leg would go into. And if that's not made specific to the user, there's just no way it's going to work. If you imagine, your shoes might blister sometimes, or a prosthetic socket, a residual limb, or we do call them stumps sometimes. That it's not, nature hasn't designed that to be put into something. So across the AT2030 program, we work on a range of different topics in development and humanitarian contexts. I currently have sort of streams of work going on in Nepal, Sierra Leone, and Kenya. And this question of localization, this is where the context, the barriers that the context presents, come front and center in whatever it is that you're trying to do. That left picture there of Nepal, maybe part of the context problem there is just these mountainous regions. How do we get anything into these places? And we'll talk about how technology could help with that. Similarly, on the right there, that's a picture of an informal settlement in Sierra Leone, Cockle Bay. Just simply, how can technologies work in such an environment? Can they incorporate sustainability strategies? You can see all the waste that's put around there. Can that actually be part of the solution? And yeah, another sort of piece of my sort of journey over this, I was for about 2 or 3 years during COVID, I was leading on a different UK aid program, COVID Action, at Local Production, Local Solutions. So that with this, we were starting out as an innovation challenge fund. That we were then working with 6 different innovators in 6 different countries. So mostly in Africa, and then 1 in Nepal, who we then continue to work with, all around this question of localization. How can we localize the production of whatever is needed? We're working on PPE. PPE, I'm sure, as you know, is a massive problem. It still is everywhere. Nasopharyngeal swabs, baby delivery kits in Zambia. I'll talk about them a little bit in a sec. But it's whatever was needed. And COVID presented to the world very clearly that the supply chains, which is an important topic to discuss as well, are inadequate in a crisis such as COVID, being a global crisis, but that's the case in more regional crisis zones as well. So yeah, next slide, please. So humanitarian technologies. So this can cover a wide range of topics. In the top left there, we have crutches. Now, we might not think of that as being, a jazzy new innovation, but we must, often it's hugely impacting. If people don't have such simple technologies as crutches, then they can't move very effectively. You have an immovable object which needs to be moved, like with help. But crutches, they open up the fact that a human can move by themselves. How we get them to people can also be greatly difficult. So I mentioned in the top right there around PPE. Again, the problems that we faced during COVID were not just the amounts of PPE that we need, but how we were going to produce them, where we should be producing them. And innovation in this area is still going on about the distribution of manufacturing. In the bottom right there, drones. Drones is a big area of development currently. It's going to open up things. I mean, I was mentioning about the mountainous regions in Nepal. Drones could be taking things to rural areas that simply vehicles can't get to, or just overcoming the speed requirements of getting really critical items like blood around into areas where they're needed. And yeah, I mean, they can serve a lot of different purposes. In the middle there, this is a product that I was working on with the COVID Action work in Zambia. In Zambia, even prior to the COVID pandemic, over 63% of mothers give birth at home in Zambia with almost no equipment. Working with a company, Safe Motherhood Alliance, to develop baby delivery kits and support packages, so that people just to increase as much as you can and reduce the risks of giving birth at home for mothers there. And then I focus on products, physical products, but technology is a lot more than that. Humanitarian OpenStreetMap in the bottom left, the mapping through various different means is opening up new avenues for us to be able to understand crisis zones and be able to plan effectively before we've even thought about what we might actually do. And critical, I mean, in the last few decades, I think I'd sort of safe to say one of the most impacting tools is the mobile phone. and both in terms of information gathering, giving out information to people in an area, and otherwise, mobile phones are changing the way that a lot of processes can happen. But it's complicated, just because they also open up great barriers, great problems and risks, and things need to be thought through. Just because they're an exciting new tech, they seem ubiquitous, they bring problems as well. So all to be thought through. Next slide, please. So some key ideas that we want to think about in this module is the systemic understanding of both innovations that have come in the past, innovations that have failed, innovations that have been successful, things that are coming through now, and what the future outlook for innovations are. And this word systemic is super important because all the product examples that I gave you before, they don't work, they're not in a silo. Their success and the impact that they can have is based in a system. And that system must be thought about throughout the whole process. And often this is where innovators fall down, systems fall down, is because there is just a lack of connection between different processes, say, along the product development chain, all the way up to the end of life prospects of products. And we'll be looking at having a critical awareness of an engagement of the debates around some of these topics around innovation in the humanitarian sector. And this is where, throughout this module, we'll be bringing in guest lectures from our networks, from various different agencies, actors in the field, experts in different product sets. As I want to be bringing in experts to be talking about their particular fields, and we will be doing that. As much as possible, we don't want to. I personally don't want to be talking about things that I don't know about. I think you want to be hearing directly from the people who have those expertise. And throughout this, evaluating the appropriacy of these technologies, it's very context specific, where one technology might be appropriate, where it might not be, and the safety around the uses of different technologies. One example to give around mobile phones, for example, is if we develop all of our systems based on smartphones, well, this might be applicable. For example, in Ukraine, you might take the fact that there might be a good proportion of people there that would have a smartphone. Well, if you develop all those systems there to be built on that, who is it that you're going to leave out? This might not be such a risk in Ukraine, but if you take somewhere like Yemen, then people might have a non-smartphone, they might have a smartphone, but who are you going to leave out? And we've mentioned disability a number of times because that's a sort of a focus area for me and Maria, although the course isn't focused on that. But the digital divide is a really important consideration when we're digitalizing the processes of technologies for this area. And then finally, just to think about the project work that we do, there'll be an opportunity to pursue an in-depth conceptual design idea, looking at a current challenge. We'll be working with partners to make these as real world possible, have people that we can liaise with and understand those conceptual design ideas. And it's important for that, for that project work, it's very much not that there's a necessity for physical prototyping. You don't have to be an engineer, you don't have to be scientists to do that. Although if you are and you want to do that, great. It's very much more about the thought process around how we might innovate and answer a problem, within the system that it will work in, as I mentioned before. So hopefully, I'll hand back over to Maria. Thanks.
Thank you, Ben. That's hopefully given you a really good flavour of how some of the module content, although it seems to be focusing on innovation or technologies, actually fits across many of the wider things we're going to be discussing around power. Ben touched upon data and how we get data, huge shifts to who collects the data in humanitarian context now, much more localized data collection using mobile phone apps, for example. But Ben also touched on who gets left out of that. And these, I think, are some of the questions that are, very current and salient in the humanitarian world and need the sort of academic training and thinking behind that, and that's what we want to offer with this course. Ben also touched upon the assessment processes. We're hoping to have a range, and we will have a range of assessments. There'll be an opportunity to give oral presentations, but there's also, as Ben's talked about, designing projects. That would also include a project management, developing your own grant. There'll be typically some essays, some exams, also a portfolio, an opportunity to develop a whole range of different sets of core coursework across the whole module. We'll also do an individual research project, which is typically something like a literature review, as well as a group project, which will be based on a live current humanitarian issue or problem. So we really want those to link to real world issues. And we're very happy to provide more details about the other specific courses if you have any questions about them. The course can be taken full-time, part-time or modular. So we very much see that this is something that can be, next slide please Alison, something that we hope will be a set of skills that will help people. We want you to have a real understanding of the deeper context that humanitarian crises, many humanitarian crises now seem to be, perhaps when we saw this war, nearly a year since the start of the war in Ukraine, perhaps many people thought it would be over within a few months, but that was, it was never going to be the case actually. And we see huge debates in the media about refugees, for example. So what are those contexts? Why are people leaving countries to come to other countries? What are the issues behind it? And when does a refugee become a migrant, etc.? We also want people to have the skills, students to have the skills to make complex decisions. We know these are really big geopolitical, environmental, health and other factors behind some of these. So what skill sets do you need to be able to really unpack those and ask the right questions? And we've, I think, emphasised quite clearly that we want you to have a cross-disciplinary perspective, because actually that can be really beneficial rather than coming at this from just a unilateral perspective, to have the best, the best available on different evidence bases behind you to really help think through some of these critical issues and give you sets of skills. Next slide, please. Really will have that deeper understanding and be able to question what people, the received wisdom. Oftentimes things are based very much on expert rather than evidence-based, and that we need to really challenge, I think. So we really want students to have the ability to analyse and evaluate those interventions, to really look what works and how it works and why it works in one context and not in another. Touched upon project management skills, the research skills, but also importantly how to work together, and that's something we hope to fostered by the teamwork and the other group projects, because inevitably if you work in the humanitarian sector you are part of a much larger team, and really understanding how to work well together with different skill sets is really vital to a career in the sector. Next slide please. That's obviously something we want to, happy to talk about more about careers. You may wish to go for a career in the humanitarian sector following this MSc, but also it will give you a wider skill set to other careers, whether that's development, global health or other other sectors. I think that we've covered quite a bit and we've talked quite a lot. We'd like to hear from you now. So perhaps if you have any questions or you want to ask anything, please do stick your hand up or post a question in. We're very happy to talk more about anything we've discussed here already. The prospectus is opened. It's available on the link here. Or you can contact me directly through, there's an address on the website for the prospectus. So please do send any emails. We're very happy to have an individual chat with you if you prefer that too. I think, Alison, we can stop sharing the screen and perhaps open the floor up to have any questions. It would be really great to hear a little bit about some of your interests, or what you're doing currently. If you're coming from the, we envision that some people that will want to do this course will already be working in either the humanitarian sector or perhaps the development sector, and be really interested in kind of really honing their skill sets. Perhaps other people will not have any expertise in that context at all, and absolutely that's really fine. We're really envisaging a mixture of different skill sets and experiences, and we think that really will make it much more of a rich debates and discussions in the course. So if anyone feels willing to tell us a little bit about their interest in this or what they were interested in, we'd be very happy to hear from you. Otherwise me and Ben will just keep chatting. Miranda, flexibility in the modules in the medical sector. Okay, so that's a great question, Miranda. Actually, we had a discussion ourselves about this, and actually the core modules, as I think you might have seen if you've looked at the prospectus, majority of the modules are core modules, because we feel that we've emphasised the gaps in the skill set. So we really want to ensure that students have, are given that the skills that will fill those gaps. What you will have flexibility in doing is choosing, for example, in the individual project, the group projects, the readings, that you can focus the direction. So for example, if you are more interested in health, that would be something you could really take through your different modules and the different options. And there are also the 2 optional modules in both of which are related to health and gender. At the moment, we expect that there will be some additional optional modules in the future. So you can certainly, within the course, choose to make your work you do more health focused. That would be absolutely fine. Does that answer your question, Miranda? Very happy if you want to speak. if you prefer to type, that's also fine.
Certainly within the technologies, I mean, health is a major theme. I mean, this is in terms of particularly around products, and then the services that are trying to be enabled in crisis zones are centered around health. Yeah. So there wouldn't be, I think, there would be well catered for there.
And certainly, as Ben said, we plan to bring in experts from a range of sectors. The interesting thing in the humanitarian sector, perhaps inevitably, is there is more evidence base around, as much, if not more evidence base around the healthcare sector, largely perhaps because often it's delivered at a health centre or a hospital, so it's easier to collect data, you know, rather than perhaps shelter, which might be built out in a more community setting. But we're certainly developing more research and evidence across all the different sectors, whether that's health, water and sanitation, communication, education, but actually they all interconnect, right? Without good health, it's very difficult to have those, you know, without clean water and sanitation, it's very difficult to have health. So there's definitely a connection between all of those things. And I think that's something we want to emphasize. The humanitarian sector has been very much set up in these sector silos, and that's great in terms of developing leadership and in developing, you know, who's responsible for what. But it also means they do seem to be artificially separate, and that's not always the case. So we certainly see that, you know, the questions that we might ask about healthcare would be relevant to the other sectors as well. But as I say, you can certainly, there's definitely an evidence base around health.
I think as well that I think the data and evidence that's to be collected that are across many spheres. I think health is often sort of stands as the best practice for a lot of those processes that come in. I mean, we often find within assistive technology that I wish that things emulated the kind of data and evidence that has to be collected for medical devices or medicine. There's often this interplay between the medical model and the social model, which is very important to take into account. But when it comes to evidence, I find more reflection of the medical sector would be really beneficial. But how that is done, how that is done well, it's to be discussed.
Anyone else want to share? I don't know if anyone else wants to share their background or have any questions about the content of the course. We're really excited that you know, the opportunity to bring in the practitioners, I think, is something we're really excited about. It's striking how many practitioners do want to come in and speak to students. I think maybe, you know, well, working in the sector, they realise what the skill set needed are, and also have quite strong opinions about what's happened that's worked well and what hasn't worked well, and are really keen to come and share that. So we're really excited that we'll have the possibility to bring in practitioners. I think that's a really important component of the course, and as well as practitioners, we're also hoping to have advocates. We've touched upon the fact that Ben and I work a lot on the disability sector, but you know, above and beyond the disability sector, you know, people are advocating for refugees as well as other groups in the humanitarian context, are a really important voice to hear, and one that perhaps aren't always heard. So advocates, activists, practitioners, we want to have a really diverse group of people that will contribute to this course.
I was just going to ask Maria why you thought UCL is a good place to study this type of program.
Really good question, and I touched on this a little bit. Obviously, UCL Epidemiology and Healthcare Institute, where the course will be based, is really world leading in much of its research around health inequalities, which of course are really fundamental in terms of some of the things we're talking about here in the humanitarian setting. I think we can obviously assume that people who are affected by humanitarian crisis will be some of the most left out and marginalized people. We see that every evening on the television when we're looking at places like Ukraine or Horn of Africa. But as I also touched upon, it's not, you know, we have the opportunity to work with people in other faculties, and that's a really interesting. Ben actually sits in the faculty of engineering, right, Ben?
Well, yeah, I was in mechanical engineering, but actually I've transferred to computer science just recently. I strictly wear neither of those hats. but I cut across different aspects.
That's a really good, one of the beauties, UCL really tries to promote and focus on the idea of being very cross-disciplinary, multidisciplinary, and I think we certainly have the possibility and will bring in experts and lecturers and guests from other departments, other faculties, and that's a really important thing. As we talked about, although we want to focus, we sit in an Institute of Healthcare, understanding how international humanitarian law impacts on access to healthcare in humanitarian crises is really vital, but also understanding, in terms of information flow, how does data science help us collect information that might improve healthcare? So really the opportunity to bring in those different voices and different perspectives from a vast range of subject specialists in a university like UCL is really hugely important and beneficial. So yeah, I think that's a really key point about UCL. Plus it's a great place to study.
I think to touch upon, I was going to say, and also to touch upon the GDI hub where I sit in, we do, well, let's just say that we're not theorists, basically. I mean, the research that we do is action research. The work that we're doing is about actual implementing strategies in different contexts and trying to understand how to do them better rather than just sitting back. And the 80-20-30 program that we work on is it's the UK's leading assistive technology program for development in humanitarian context, but also globally. And what's interesting about the GDI hub is we have wings where we're a research group, but we're also a community interest company, and that enables us to operate in a way in which some things you were doing as a research group, but also more acting as an NGO. And we work across those two different spheres. And in terms of innovation, we often find our conversations are sort of looking at what are these actions that we're really doing? Sort of like it's research-based innovation and innovation-based research, depending on who is sitting where. And that's one way we like to think about it.
And actually, to build on that, I think one of the other things is partly because of that, the way the research in the humanitarian sector is often funded, whether that's through UK government or the United Nations, we have really good connections that we'll bring to bear to this. So, for example, the humanitarian assistive technology and humanitarian settings work that I've been focused on was funded by the UK Foreign, Commonwealth and Development Office. So again, we have contacts in FCDO, but we also have really good colleagues and connections with the World Health Organization, with UNICEF, with the United Nations High Commission for Refugees. And I think that's, in addition to having the academic context, we also, as I emphasize, have those practitioner focus. And this can be really great in terms of bringing in that subject and specialist expertise and knowledge, but also in terms of potential career pathways, that those links can also be really good. Also in terms of developing those real world case studies that will actually work with organizations that are in the forefront of humanitarian interventions globally. And I think that's a really, a benefit that you perhaps won't always get in other courses, but certainly we'll be able to bring to the course here. So yeah, that I think is really important.
I think a comment that Maria made earlier as well about like sort of where people are coming from. It's important not to sort of shy away if you think that you are you don't know about this now, and you're going the right direction. Certainly I, throughout my sort of academic progression earlier on, I was I went to prosthetics. I was particularly interested in prosthetics, but mostly worked on the much sort of higher tech end around sort of 3D printing sort of more exotic structures, but quickly kind of began to look and realize that actually as we know, 95% of the amputees in the world are not in high income settings. They don't have money, and they're in dire need. They have nothing, and this sort of captivated my attention. And then that sort of from PhD onwards kind of shifted my direction. And now, of the grants that I work on, 4.5 days a week out of 5 are on development in the humanitarian context. But it's important to just realize that even if you're not right now where you are with your studies, that you don't work on this on this area, the different skill sets that you need. I was describing where I've come from, but lots of people in this sector, they come from all different angles because, people in need in these contexts, they need everything that everybody else needs. Even if you're just sat in London, you need all the same things, and therefore you need all of the same sort of systems but they're just harder to create around them. So there's a lot of different routes in, I think I'm trying to say.
I think that's a really important point, actually, Ben. Thank you for reminding us. Alison's also posted some information there about scholarships, and also just to say, as I touched upon this, it's certainly available for you to be part-time or full-time or modular. So there are various different ways you can undertake master's programs at UCL, and I think that's on the website. But again, happy to have a chat with you personally or individually if you would prefer to. Very easily contactable.
I think we had, so what did we find out? We had Miranda, who's left. She was saying that she was coming from the medical sector. Can we get, if you don't mind, I mean, can we get an idea of what your backgrounds are, Vanessa, Alice? Don't be shy. It would just be really interesting for us to know who of the people that are interested in the course. What are people doing now? I mean, what's your thoughts?
You can type it if it's easier.
Oh,
Yes.
Hello, I'm Vanessa. Nice to meet you. I'm currently a biology student, and I'm really interested in health policies and public health. And then I saw this course, and I'm really interested in humanitarian work as well. So I just wanted to know more about it.
It's great. We hope, do you feel you do know a little bit more about it now, Vanessa?
Definitely. I'm really interested, but then there's also the science aspect that I'm really into and that I really like. So I'm not sure, but I'm looking at all my options.
Of course. Good. Well, we're
Great,
very glad
thanks,
that you were
Vanessa.
here today. Thank you. Alice, don't feel you have to, but if you want to, you're very willing to just share your background too.
No worries.
I was going to ask Maria and Ben about the, I think Alice has written in the chat.
Great, that's really helpful, Alison, thank you.
But just about the compulsory modules, and I think, did we go through them in the presentation?
I did go through the modules in the presentation very quickly. So all of the modules listed are compulsory, as well as the group and individual projects. As I think I said when Miranda asked, there's only one optional module because we feel that the skill set needed needs to be covered by the core modules, and sometimes if you give too many optional modules you don't then get the opportunity to cover all your core skill sets. So we have a one optional module that's available for students, but as I say, that's definitely something that we feel that the core modules within them, there's a degree of flexibility to undertake particularly the individual and group studies, particular areas of research that you might be interested in. But yeah, the modules are on the slides and listed on the prospectus are the core modules.
Thanks, Maria.
Hi, I actually have a question. Are there any conferences to know more about humanitarian work that is happening around the world or to meet people involved in them?
Yes, there are lots is the answer.
Yeah. Okay.
But one place you might start to look at is there's an organisation called the International Humanitarian Studies Association. I think you can join and become a member, but you can also just look at their website, and I can post the link to you in the chat right now. But that's probably a good place to start. There's various, of course, the United Nations have various different things, but I think that's probably the best one to start with, I think.
Okay, thank you.
I'll post it to you right now.
Thank you so much. Do you believe that courses such as public health would give a little bit of a humanitarian work perspective as well at UCL?
At the moment, that's probably only covered by, perhaps touching on COVID, for example, might be the closest. So not so much. I think the global health perhaps a little bit, but if you're interested in the humanitarian, then yeah, then the course that looks specifically at the humanitarian would give you a much bigger, wider and more in-depth perspective, I think.
Okay, thank you.
I put the
Public
link
health generally means high
Thank you.
income, isn't it?
it tends to focus on higher income countries, but as we see, I mean, I think when you're looking at humanitarian context, it's very, we will be looking mainly at lower middle income countries, but we see that even higher income countries, climate change is really clear that countries are increasingly being affected by humanitarian crisis. And I guess the question in that is which groups are being the most affected within those, and we often see it's the most marginalized and excluded groups, coming back to the health inequalities work. But a lot of the sort of protracted humanitarian, and I guess Ukraine is the obvious one, that's certainly not seen as a lower income country, but politically and geopolitically, we see that the conflict has gone on for a long time, and it's interesting to look at the alignments of different states and countries around that. So I think although we tend to think about humanitarian conflicts as being low income or lower middle income country, we're also increasingly, perhaps Syria and Iraq were not necessarily lower income countries when the conflict started, but the impact of the conflict is inevitably going to be that people's quality of life deteriorates. So yeah, but it's a good question.
Human science, just to mention, we can respond to you, Alice. I think human science is a really interesting degree to be coming at this from. I mean, for all of the points around intersectionality that Maria's already said about. Yeah, in terms of thinking through all of these problems, I feel like those skills would be very, very, very useful. Similarly with biology, I mean, not to say I have a degree in biology, Vanessa.
There you go. I forgot that.
Oh, that's really nice. How did you get into humanitarian work?
Well, as I said, so I started out with a master's in physics, but I was focusing on biophysics, and then I always from science. I love science, and I think I always find myself always expanding in terms of like the utility of what I wanted to do. Although I see each science being incredibly useful. Some things, maybe next year, maybe 50 years time, maybe 100 years time, depending on what it is. But always just thinking about what's useful to people now. And quickly I sort of moved more from biophysics and mathematical biology. I was looking at skin into a PhD that was looking at emulating skin for the inside of prosthetic surfaces. I was, moved into engineering, wanted to make something. I was interested in making something that's useful. Now I sort of have this much more of a focus area around local production systems and actually how things get made, as well as what's getting made. And so that's sort of how I, sort of expanded out from that. And I think that the kind of skills that you come at from science and just that understanding is really important. I mean, for example, with the COVID action work that I was doing over the last few years, we actually had a number of biologists that were coming in to help us facilitate understanding around the production when we were producing medical devices, PPE, nasopharyngeal swabs. As you can imagine, sterility is really important. So we're bringing biologists in to try and help producers in low to middle income countries to work out how those processes could be best done there. And you need that kind of understanding. And if anything, from as I've described, I've sort of gone expanded out in terms of what my focus area is. But equally, you don't need to do that. There's people that work on very specific biological or medical tasks. There's as I said before, it's in these sorts of contexts there's the same need of understanding from different angles as there is in any other human sphere.
Thank you.
Very fortunate we had you there, Ben, to have that discussion about biology. Alice or Alison, if there's no more questions, we're very happy to close, but we're very happy to stay here and chat. If anyone has a particular question or if you want to talk to us individually, do contact us after.
Yeah, I'll just pop the email address for the programme in the chat if you have any other questions.
Yeah, we are doing 2 more of these, so if you feel like you want to come again and have an opportunity to ask a question, I think the dates of those are also on the website, the prospectus website.
Yeah.
So, you know, or tell your friends.
Yeah. Okay.
Yeah, it's not the easiest email to remember, is it? I have to say. You might have wanted to think that one through. I didn't set it up, just
None of the words really short.
yeah, I mean, I guess it's not that. Yeah, I don't know. There must be a reason for that, but okay. If you don't have any questions, please don't really have to. Alison, it's okay to finish 10 minutes early, right? We don't need to.
Yeah, completely fine. Completely fine.
Don't really have to you know, hang around if you have other things you need to do, but we will be here for the next 10 minutes, so you know, if you want to stay, please do stay. If there's any other questions, I'm you know, really excited about this program and hope to see some of you on it.
Thanks so much.
Thank you.